We noticed with our exchange and our claims, there was a delay in the response from the payers. Our technology team looked into it and seen that there was a hack.
Healthcare providers are still dealing with a cyber attack on Change Healthcare.
Hackers broke into Change Healthcare's portal on February 12th using stolen credentials, breaching a server not equipped with multi-factor authentication.
And offices are going to lose their minds. The doctors are going to be upset. They don't have a full understanding of how, the processes of claims and rejections and clearinghouses and how payments come in and things like that.
But they still can't tell you when our claims going to be paid.
Soon, medical providers grappling with system outages used for medical billing and insurance claims. But
the mind-boggling part is that how much reliance we put on this one company, and the fact that this one company took down the whole system, especially for a lot of EMRs that are completely reliant on this service to process the claims.
Hospitals and other medical practices have not been able to process bills and get payments they need to operate.
All of a sudden, this hack was, like a huge collision in the highway, and all traffic stopped. Our phones were off the chart. How am I going to pay my employees and things like that? So these was ongoing issues that we were hearing from the doctors.
We found out at the same time they found out on the 21st of February that something is going on. We have to evaluate our systems as well.
When we got notified, we adapted and adjusted very quickly. Our engineers jumped on it. We took fast action.
At Enable Healthcare, we were able to quickly and securely get the claims out.
We have built-in redundancies with other clearinghouses, so the claims get processed, and then the practices as a result don't feel the impact of the delay.
Like, the main focus was all of us coming together, working around the clock with the IT team and RCM team, and getting those claims out as quick as possible, so no offices felt that lapse in revenue.
After this hack, we enforced artificial intelligence much more.
We use our AI technology to help us find the proper routes to ensure that we're able to send the claims out through the right clearinghouses and ensure that we get a timely result of our revenue cycle that's coming back in.
We were able to get that speed that the doctors rely on.
Cash flow is paramount for them, so we understand that. And we take every step that we can to ensure that that money comes in and those transactions are processed cleanly and addressed properly.
Meeting of the Senate Judiciary Committee will...
The Department of Health and Human Services says it plans to step in regarding a cyber attack on Change Healthcare.
How in heaven's name did you not have the necessary redundancies so that you did not experience this attack?
The country needs tough cybersecurity standards, and they're needed to protect critical infrastructure and patients across the country.
At Enable Healthcare, security is our top priority.
You got to protect this data. You have to protect the providers.
There's always focus on today, but we're also planning down the road too.
So Enable Healthcare has taken many steps to ensure that we have the proper backups, proper support systems for our clients, so that we have limited downtime for our clients, so that they are able to see their patients, send out claims, do everything they have to do through the system in a timely fashion.
Our technology team is always meeting, huddling, and making sure that if this happens, what do we do here? If this happens, what's our next move there? So they're always procuring the data and making sure there's built-in redundancies so that if there is a situation that happens like with the cyber health attack, that we're in the ready position always.
At the end of the day, if we have everybody happy, that's our goal. That is our goal. To make sure that, we provide the service that they are looking for.